I am Ahmed Elamin. I am a medical doctor. I did my postgraduate study in epidemiology statistics. I joined WHO West Darfur office since December last year, 2015. Before that, I was working with the epidemiology health emergency department of the Sudan Federal Ministry of Health between June 2014 and November 2015. Before 2014, I spent my working life in Sudan National AIDS Program between 2002 and 2014. Regarding the assessment we did during my working with Sudan National AIDS Program, we did some kind of risk assessment because, as you may know, that Sudan HIV epidemic is concentrated epidemic. And the question, is there any potentiality that HIV can spread from a specific subpopulation to the general population? I think it is a little bit different from risk assessment regarding the other communicable diseases, for example, hemorrhagic fever or Ebola. When I joined the epidemiology department, I came just few months before the outbreak of Ebola, West Africa. So we have to do some kind of risk assessment, which is totally different from that we used to do during my work in HIV/AIDS area. Last time I conducted risk assessment is during the Ebola outbreak in West part of Africa, when Minister of Health, Sudan Minister of Health, asked us in the Department of Epidemiology to do something regarding this issue in case that one single case enters the country. First, we collect information from Khartoum. We contact everybody, every organization that can help in this regard. We contact Ministry of Foreign Affairs, Ministry of Interior, Civil Aviation Authority. We ask about the movement of the population from Sudan and to Sudan from west part of Africa, from the country affected by the outbreak. And when we collect the information, after that, we go to the field in joint mission to assess the risk and also to assess the capacity of the Minister of Health at the state level. And the question we have to ask about is there any possibility that Sudan can receive one single reported cases from west part of Africa? And also we ask about who will be the potential carrier of this one single case, because there's a massive population movement across the border between Sudan and Chad. We focus on Chad because it is have higher possibilities that to be the country that the case enters Sudan from it, because Chad between Sudan and the affected West Africa countries. Also, we contact everybody or organization or governmental organizations that can help in providing information or to provide logistic support, because we need to move in different parts, and as you know, therefore security-wise is not secure. So we ask the military organizations there, the army, the Ministry of Interior to help us in that. The finding is the possibility for Sudan to receive a single imported case from West Africa is very, very, very small. But if this happened, if Sudan received one single imported case from West Africa, the Sudan will be in dilemma, and because the medical infrastructure is very fragile, the surveillance system is not so good that can capture any single case. The medical staff was not trained how to deal with this kind of disease. The number of the medical staff is not adequate to fill every position that need to provide services. Yes, before to leave the country, West Darfur or state in west part of the country, we brief Minister of Health and its partners. NGOs, international NGOs working there, Ministry of Interior Affairs, joint Sudanese, Chadian troops. We briefed them verbally with our findings, but we didn't give them an official written report. The official written report is the responsibility of the Federal Minister of Health in Khartoum. Security come first. Security instability in Darfur is a problem. We cannot move to the field without to be escorted by troop, UN peacekeeper or police of the government. If we go without escort, we will put ourselves in hazard and could be attacked. Our car can be jacked. And also the surveillance system is not strong enough to reflect every health event in the field. It is still a pure facility-based surveillance system. It is not includes the community where there is no facility health asset there. The technical capacity of the staff is not so good because whenever you train staff, they will move. There is a very rapid turnover of the staff here. And also the infrastructure of the health system is there. For example, any specimen taken from suspected cases should be transported to Khartoum and sometimes beyond Khartoum to be tested. When it come back a little bit later. I think there's many lessons we learn. Sometimes there is a crucial information outside the Ministry of Health if you will help you a lot. Minister of Interior, for example, have the actual number of the traveler between Sudan and South Sudan, a different entry point, airport, seaport, land entry point. If you know that or communicate with them, they will give you the pictures that you can build on it. Because many entry point throughout the border, there is no official existing health facilities belong to the Ministry of Health. We need to work on community-based surveillance system. Facility-based may not reflect anything that happen in the field. So you may need to build on community-based surveillance system because you may not to know the cases before to come to your facility, and if you have no monitor that in the community, you may find yourself in situations that cannot be controlled. I think the lesson learned also about the filing of the thing, the database in the peripheral area. It is very important. What happening before? This is not for Ebola, for other diseases. For example, viral hemorrhagic fever. We need to build the institutional memory of our state Minister of Health. And also you need to support this state Minister of Health technically. It is very, very difficult for every health-related event or emergency for a team to come from Khartoum. It is not a practical thing. You have to build the capacity of your colleague working there in the front line as the state. Regarding the risk assessment, the idea is one, but sometimes the approach may be different according to the what kind of risk you are assessed, and also what kind of the situation in the field. For example, security is a very big issue, and we have to prepare ourselves to that. And very important, you have to select who will be your potential partner and do your best not to ignore them. The politicians, they are very important. If you present your case well to them, they will help you. They can provide you with your need. So in summary, I think if you want to assess risk, you have to to know who will be your partner to communicate him or to communicate them from the beginning. This will help you to collect information and will help you later when you prepare your response plan. Thank you.